Pneumoconiasis. The pneumoconiasis is defined by the ILO. The ILO think as accumulation of the dust in the lungs and the tissue reaction to its presence. And the tissue reaction may be non-collagenous or collagenous. So from this term, you will see we first need accumulated of dust in the lungs. And the concentration in the lungs is the first step. With the enough dose of the dust in the lungs, the tissue will reaction to its presence. And this reaction increased by the concentration of the dust in the lungs. And this reaction had two different types. One is non-collagenous and another one is collagenous. Pneumoconiasis as a contribution or primary cause of death in different countries. And in some countries, the majority of these cases were called workers' pneumoconiasis and silicosis and asbestosis. In China, silicosis is the majority of this pneumoconiasis. And rate of the death from pneumoconiasis is declined, but the silicosis remains prevalent in many regions and industries. For example, in China, we still can find lots of workers with silicosis disease in a working place. Let's introduce the pathogenesis of the pneumoconiasis. The pathogenesis of the pneumoconiasis is fibrogenic dust. The fibrogenic dust can produce progressive fibrosis in the lungs. So, the most important of the pathogenesis of pneumoconiasis is the progressive fibrosis in the lung. And how does the fibrosis created in the lung? So what's the mechanism of pneumoconiasis? First, the dust can damage the mucous ciliary carriage system. From this picture, you will see at first we have a healthy fibrosis, and after the dust goes inside the body and the concentration increase, the healthy one tends to be the unhealthy one. So the mucous ciliary carriage system damaged by the dust. Another one is two different type cells, especially macrophage. The macrophage is a type of white blood cell. This can help the body fight infections and disease. We also call macrophage as a big eater. This big eater crawl around the fluids of our body and they ingest these microbes. And part of the cell surround the particles to be eaten, then the macrophage membrane flows together and the particle end up inside. But for some of the particles, for example silica, they are very special. You will see this picture, these big eaters swallow dusters. And you will find the black spots inside the orange vacuoles. And this picture shows when the particles go inside, the macrophage start to swallow it. You will see after they swallow these orange spots, the particles, the macrophage can produce different things in the cell. It can produce the fibrogenic factors, for example, TNF-alpha and IGF-1 and so on. And it also can produce the toxic factors, for example, the oxygen-free radicals. They can make the lung injury. And it can produce pro-inflammatory factors. These pro-inflammatory factors, including IL-8, IL-6, TNF, and so on, they can activate the inflammatory cells and recruit the inflammatory cells. These three different things created by the macrophage after it swallows the particles, and they finally can change the fibroblasts and the collagen production, so make a fibrosis. So from this picture, we will see the macrophage is the target of the particles, but after the macrophage swallow the particles, try to destroy it, but it failed. At the same time, it can produce different factors which make fibrosis at last. And it is very hard to destroy the dust by the macrophage. And the dust still stay in the lungs and then destroy other macrophages. So at last, you will find the healthy fibers turn to be the unhealthy. So this is the hypothesis of the macrophage destroying the fibrosis. And scientists, they are still doing some researches to find out how the dust destroy our lung systems and make the fibrosis.